Hey guys, this is Dr. Michael Tancini from Ground to Overhead Physical Therapy, and today's question is, how do I fix my knee pain? I see this a lot in my practice. I get this question all the time. Athletes come up to me and say, I've had knee pain now for years. Every time I squat, every time I run, every time I jump, it just kills me. It started with I bought some knee sleeves that helped for a little while, but now the pain just keeps on coming back. Every time I drive to work, sitting in the car is just killing me. Every time I go up and down stairs, it just hurts. How do I fix this? Well, fixing it isn't as easy as just arresting and not using it. Many athletes find that they experience this chronic knee pain, they stop squatting and they stop doing things that make it hurt, and as soon as they start squatting again, it comes right back. Now, definitely want to stay away from any kind of injection or any kind of surgery, as there's ways to fix that knee pain for good without any of those things. So, when we talk about this chronic knee pain, we're talking about patellar tendinopathies. We're talking about, you might hear it called a runner's knee or jumper's knee. We're talking about that pain right on the front of the knee. It hurts when you squat or go into that deep knee flexion. First thing that we need to do in order to fix this knee pain is we need to take away the excessive stress that we're putting on that knee. Okay? So, if you're going to the CrossFit gym or you're running every single day, you're running 20-30 miles per week, or you're going and you're doing 100 air squats during your CrossFit workout, we need to dial all those excessive stresses on that knee back. Okay? While we do that, while we dial back the stress on the knee, we need to work on improving our movement patterns. So we need to look at your squat pattern, we need to look at your running mechanics, your jumping and landing mechanics, and we have to make sure those mechanics are solid. Okay? We have to look at, do you have the mobility and are you stable enough in those motions to actually perform those movements correctly? Guys, this is the process. It isn't going to happen in one session. It isn't going to happen overnight. Okay? But there are things that we need to be thinking about as we move through this process of fixing our knee pain and our knee problems. Lastly, this is an extremely important part of it. We actually have to load the knee. Okay, so we're taking away the excessive stresses on the knee, and we're progressively loading that knee, loading that tendon over time to accept the loads that we need to be able to throw at it. Okay. Now, how do we load the knee? Well, we do this through different kinds of squats. We do it through box squats, Spanish squats, Bulgarian split squats, goblet squats, back squats, single leg step ups. There's tons of ways in which we can load that knee or load the patellar tendon in a controlled manner. Okay? We stick to this over time. So we're looking at perform the movements to a point to when it might cause a little bit of pain in the front of that knee. Okay? I like to keep my patients below a 3 out of 10 on the pain scale after they're done doing all the movements. They may experience this pain for the rest of the day, but as long as they're back down to their baseline level of pain within 24 hours, then we know we gave it the right amount of stress for that knee. We do this over time, and eventually the person's able to get back to their heavy back squats, to full training, doing everything they need to and want to in life without any kind of knee pain, and they can go on living happy. So, the answer isn't rest. Okay? In an acute situation, that's when we may just choose to rest and it goes away within a few days. But if this issue keeps on coming back, we actually need to remove excessive stress off the knee, improve our movement, and then load that knee over time to get us back to where we want to get to. Okay? So, this is Dr. Michael Tancini of Ground to Overhead Physical Therapy. If you guys have any other questions regarding anything that you're currently dealing with or one of your friends are dealing with, shoot a message to me, and I'll be happy to answer for you. So, thanks for watching, and I hope you guys have a great day.